There is something I've seen far too often over the years. A patient walks into my office, calm, composed, maybe just a little tired. They sit down, take a breath, and say, "Doctor, I think I'm fine. I'm just getting older." And at first glance, nothing seems alarming. But when we look closer, their blood pressure is quietly higher than it used to be. Their resting heart rate has crept up. Their blood tests show subtle changes. Nothing dramatic, but not ideal either. And this is the part that concerns me most. They feel fine, because the most serious heart problems after 50 rarely begin with pain. They begin with silence. I've spent more than 4 decades in medicine, and if there is one consistent pattern I've observed, it is this. The heart does not suddenly fail. It adapts, compensates, adjusts, often for years, without complaint. Now, before we go further, let me be clear. What I'm sharing here comes from my experience as a physician, but it is not personal medical advice. Every individual is different. Every medical history is unique. If something concerns you, you should speak directly with your own healthcare professional. If you find this helpful, you may consider subscribing, not for quick answers, but for careful understanding over time. Now, let's address something that sounds harmless, but can be quite misleading. This is just aging. I hear that phrase almost daily. And, yes, the body changes with time, but many of the changes we attribute to aging are actually the result of long-standing habits, working quietly in the background. And this is where most people underestimate the risk, because nothing feels urgent. There is no clear warning, no obvious turning point, just small shifts, accumulating over time. Let me explain what I mean, step by step. The first factor is chronic, low-level stress. Not panic, not crisis, but the constant mental load. Thinking about responsibilities, finances, family, health. This keeps your nervous system slightly activated. Even when you believe you're resting, your heart rate stays a bit higher. Your blood vessels slightly constricted. Your hormones subtly out of balance. Now, one day of this is not a problem, but years of it begin to shape how your heart functions. The second factor is sleep, or more precisely, the lack of deep restorative sleep. Many people tell me they sleep long enough, but when we look closer, the sleep is interrupted, shallow, inconsistent. And here's the key point. Your heart depends on deep sleep to recover. During that time, blood pressure naturally lowers. The heart rate slows. The entire system resets. Without that reset, the strain carries over into the next day, and the next, and the next. And this is where most people make a quiet mistake. They accept poor sleep as normal. The third factor is prolonged sitting. Now, this one is often overlooked. You may walk in the morning, perhaps even exercise a few times a week. But if the rest of your day is spent sitting at a desk, in a chair, watching television, then circulation becomes less efficient. Blood flow slows, vessels lose some of their flexibility, and metabolic processes begin to shift. This doesn't feel dangerous, but over time, it contributes to cardiovascular strain in a very real way. The fourth factor is diet, but not in the way people usually think. It's not only about weight, it's about what the food is doing internally. A steady intake of processed foods, high in sodium, refined sugars and additives can quietly increase blood pressure, promote inflammation, and alter cholesterol balance. And inflammation, although invisible, is one of the key drivers of artery damage. The fifth factor is mild dehydration. This is more common than most people realize. As we age, we often feel less thirsty, so we drink less without noticing. But even a slight reduction in hydration affects blood volume and circulation. The heart must work harder to maintain adequate flow. And, again, this is not dramatic. It is subtle but persistent. Now, here's a point where I want you to pause for a moment because this next factor is often dismissed. The sixth is ignoring small, recurring symptoms. A little breathlessness when climbing stairs. A brief sensation of pressure in the chest. Moments of unusual fatigue. Individually, they seem insignificant. But when they repeat, they form a pattern. And in medicine, patterns matter. This is often the body's early way of signaling that something is beginning to change. The seventh factor is medication management. Many people take medications for good reasons. But over time, dosages, combinations, and interactions may need adjustment. I have seen cases where medications perfectly appropriate at one time later contributed to low blood pressure, irregular heart rhythms, or fluid imbalances. This is why periodic review is not optional. It is essential. And now, let me introduce something less obvious, but equally important. The eighth factor is social isolation. Now, this may seem unrelated to the heart, but in reality, it is deeply connected. People who are isolated tend to move less, sleep worse, and experience more underlying stress. There is also something else, a subtle emotional strain that is difficult to measure, but very real in its effects. Over time, this too influences heart health. Now, if you take a step back, you begin to see the full picture. These are not dramatic risks. They are not sudden events. They are small, just consistent pressures, acting on the heart day after day. And this is why they are so often overlooked. Because nothing feels urgent until the accumulation becomes too great. So what can you do? In practical terms, let me give you a simple framework. First, observe your daily patterns honestly. Sleep, movement, stress, hydration. Second, reduce long periods of sitting. Even standing or walking for a few minutes each hour can make a meaningful difference over time. Third, improve sleep quality. Consistency matters more than perfection. Fourth, simplify your diet. Fewer processed foods, more natural ingredients, no extremes, just steady improvement. Fifth, stay hydrated. Make it a routine, not a reaction to thirst. Sixth, pay attention to recurring symptoms, not with fear, but with awareness. Seventh, review medications regularly with your doctor. And finally, stay socially engaged. Even small interactions can have meaningful effects on overall health. Now, I want to leave you with a final thought. The heart is remarkably patient. It will adapt, compensate, and continue working, even under strain. But it keeps a record of how it has been treated over time. The encouraging part is this: positive changes, even small ones, can begin to shift that trajectory. If this has given you something to reflect on, something to observe in your own life, then stay connected. Not for quick solutions, but for steady, thoughtful guidance. Because when it comes to the heart, it's rarely about one decision. It's about what you do, quietly, consistently, every day. And sometimes, the most important changes are the ones no one else can see, but your heart feels them over time. And if you start paying attention today, even in small ways, you may be quietly protecting your heart more than you realize.